Hey love, hey love, hey love. Looky here. So today marks 2 years since my former OBGYN mutilated me and made me a part of the unnecessary 600,000 hysterectomies that occur in the United States alone every year. And if something should happen to me for exposing that information, I don't know if I'll get to the part where he writes. I will get to the part where he writes that my uterus was normal. But in my medical records, some of what I highlighted after I went back and finally got them, because now that I have a urogynecologist, she was telling me that I probably was damaged, nerve damage. And I was like, what? We never discussed any nerve damage. And the fact that my bladder and my bowel, my intestines dropped. So I have severe incontinence, which is one reason why I cannot get into physical therapy in the pool, because they don't allow people who have bowel incontinence. So I'm struggling even more after my pelvis dropped, my hip got a tear, a labral tear, and I just had surgery on the hip. It took 2 years to get that done. But look here. I was negative for menopausal symptoms, hot flashes, insomnia, night sweats, and vaginal dryness. Negative for abnormal bleeding, abnormal vaginal bleeding. I did have anxiety. He knew that. Or decreased libido. I never had that. Depression I did have. Difficulty falling asleep is the same as insomnia. A history of infertility, because he would never test. He kept telling me, as long as you're having your period, then you can get pregnant. And I kept asking for testing, but he didn't do it. But he put, I was negative for urinary incontinence, because I was. I wore a pad every now and again, but it was nothing like what I have to do now, where I'm in full-blown pull-ups, right? So then he says that he discussed, because I asked him if he could do another myomectomy like he had done before, and he said he couldn't do it. Hysterectomy was the first option. I don't know what this UAE is, because we never talked about that. Or he said waiting until menopause. But I've been in menopause since 1986, when I had my left oophorectomy, not knowing that also my fallopian tube was taken. I didn't find that out until after this castration. So we had an MRI January 12th of 2022, where it showed fibroids. I've had fibroids for several years, and it showed that my uterus was thickened. It was enlarged, and it suggested adenomyosis, right? So he advised that he would request authorization for a robotic hysterectomy for an enlarged uterus. We didn't go over something that could be done prior to that. I kept begging him, is there anything else you could do? Can't you do the myomectomy? And he said no. We didn't talk about blood transfusions. We didn't talk about severe pelvic adhesions. He did not discuss all the risks. I had a lack of informed consent, a complete lack of informed consent. And I seriously believe this note was changed after I told him that my urogynecologist said that I had nerve damage, right? Because he's here negative, reproductive, no irregular menstrual period. Then all of a sudden, he sits up and says that I had menstrual issues, right? But when you look at his lab work, preoperative diagnosis, chronic pelvic pain, adenomyosis with pedunculated fibroid uterus and dense pelvic peritoneal adhesions. But then when he goes into the procedures and talks about it, oh, Lord. There was 8mm trocar, right? So we already know I had adhesions and I had fibroids. Left side. My colon, I didn't know it was elevated. But because he couldn't get through robotically to my uterus, he cut me, which he told me that he might have to cut me, right? He told me that at like 7 o'clock in the morning, The paperwork that I signed, it was 6:58 when they gave it to me. I got there at 5. I'm already IV'd and everything, laying on the gurney and about to go in. So of course, I'm not sitting up reading everything. Surgery is supposed to start at 7 o'clock. All right. When he gets in, the uterus itself was not enlarged. Can y'all see that? So it was no longer enlarged, which means any caring doctor who sees that the previous diagnosis is no longer relevant would have stopped right there. The fibroid was clearly visualized. Okay, remove the fibroid. But you see the uterus was not enlarged. There's no need to go on with this. The uterus was small. It was small. Y'all, I didn't read this paperwork for, a year and a half? About a year and a half? It was October of 2023 when I finally read this paperwork. The specimen, the cervix, and my uterus, and the fibroid were all sent to pathology. The right ovary appeared somewhat atrophic but viable. When he came to me, I was alert, but I wasn't unstable. I was stable and alert, but I didn't really understand anything. And he asked me, what did she do to you? And I was, I'm sitting up like, what the heck? What did she do to me? So he forgot that he'd done a previous surgery on me. He made it seem like my former OBGYN when I was 13 had done something to me. But in essence, it was him that it did something to me. Number one, you saw my uterus was normal. You didn't need to remove it. You didn't need to do that and cause me all kind of prolonged medical issues because of it, because you knew exactly what would happen when you removed a healthy uterus. Even if it's not healthy, they know. All of my stuff, surgical pathology report, no adenomyosis is identified on representative sections. I didn't even have it anymore. All it says is the endometriosis of the uterus. I would have never, I've been having pain since I was 13. So at 48, it's not like I would have said, okay, let's get rid of, there's no post-op diagnosis. I didn't have adenomyosis by the time he got to it. He told me that a hysterectomy would fix the problem. All right. The way that my uterus was sized, it wasn't even its normal size. My normal size was 7.0. It was 5.5. There was no hemorrhaging, no necrosis, no need to remove my uterus. Then I come in because there was a tear in my hip and I almost fell. Now I'm back on the walker. He gonna sit up and say it's due to pre-existing hip problem. It was not. I drove myself to the hospital. I haven't driven in 2 years now. I haven't walked on my own in 2 years now. I told him I was now having hot flashes, couldn't get to sleep. I was having bad dreams and everything. I wasn't emptying my bladder, but I was having incontinence, severe incontinence. All right. Before the time runs out, any of you ladies that are even thinking about getting this done, because like I said, I signed this paperwork. It was time for me to go into surgery by the time I signed it. It was 6:58. I don't know where the other paper is right now that shows the time. But I didn't read through all this. I just went through and signed. I didn't know that I could die, that there would be uncontrollable leakage of urine, injury to the bowel, hormone deficiency. I didn't know all this. We didn't talk about this. I didn't know about osteoporosis. I didn't know that. I didn't know that I would get breast lumps. Now I'm susceptible to breast cancer. I already knew I wouldn't have no periods because I wasn't having any for a while. Yet he went back in my records and changed and said that I was having severe bleeding, which I was not. I wasn't having all that. I didn't look at this stuff, y'all. You got to read this stuff. You have to. And if your spirit says don't do it, I should have left it alone, but I didn't. And I'm paying for it now. Learn from me. Don't do it.